I don't know why kidney disease is becoming so rampant these days, especially among youths, like people less than the age of 30. It is so common. So I have come to share some tips that can help us to maintain a healthy kidney. The first point is to stay hydrated. It is very important because most of the things we eat, the drugs, the chemicals we inhale, they all pass through the kidney. So we need to be drinking a lot of water to be flushing our kidneys. If you notice that the color of your urine is not colorless, drink enough water to flush it. That is the first point. Another thing is drug misuse. A lot of us, we misuse drugs a lot. Any small thing, we'll start taking antibiotics without knowing the bacteria that we are treating. If you feel like you have infection, the right thing to do is to run a culture and sensitivity test. Okay, the essence of running this test is, one, to identify the causative organism, and then the drugs that are sensitive to your body. That is why it is called sensitivity. Because, for instance, if you are sensitive to gentamicin and resistant to chlorophenicol, for instance, without running this test, you will not know the drug that you are sensitive to. You might start taking the wrong drug, taking drug that your body is resistant to. One, it is not doing anything to your health. It is not improving the treatment. And two, you are loading your kidney with drug that your body doesn't need. So you can imagine what is happening. So let us always run tests. Let us always consult doctors before embarking on any treatment, okay? Then another mistake we do is that most of us mothers, we always place our toddlers on solid drugs, like drugs that syrups can take care of, like paracetamol, for instance. Most of us will bring para and divide it and start giving them. The best thing for any child that is less than 5 years is to be on syrup, because you can't start loading their kidneys with, taking care of drugs. Starting to digest drugs is workload for them. So always go for syrup for your children, okay? Another thing is healthy lifestyle. It is very important. If you are smoking, just quit, okay? Because you are doing yourself more harm. If you are this type that drinks alcohol a lot, is of no use. There's nothing wrong with alcohol, but don't abuse it. Don't take it to the extent of exposing your kidneys to harm, okay? So these are the minor things that we overlook, that over time they will always dispose one to kidney disease. Also minimize your salt intake, okay? Check your blood pressure regularly. Blood pressure is not for aged people only. Once you are up to 30 years, heading to 40s, always check your blood pressure. It is very important, because these are the things that, if not managed well, they can also lead to kidney problems. Check for your blood glucose level. It's very important to always go for checkup, and always run a test that is called electrolytes, urea and creatinine. That is the kidney function test. Once in a while or once in a year, run that test to know the state of your kidney. It's very important. Nobody has that money to undergo dialysis or kidney transplants. So it is very important that we always take all these preventive measures ahead of time. Share with your friends, share with your family members. Let them know the importance of staying hydrated, avoiding self-medication, and healthy lifestyle. Thanks for this quality time with Tessie. See you in my next video. Bye.